one of the things you mentioned was just, if that's the case, you're seeing a lot of, we're seeing a lot of people coming into office visits or into the hospital with something that we can't find a physical reason for, and it's an emotional thing. How does this model of medicine that we have really work when a doctor only has 10 minutes to spend with you? Like, how can you get to the root of anything?
Yeah, that's a I think a big problem and an issue that we're seeing in the current model of healthcare. When you look at the healthcare, the way it's gone over the last, let's call it 50 years or so, the technology is like advancing at a rapid pace. If you would have told me 30 years ago when I came out into practice that you could replace an aortic valve with a needle stick, I would have told you that's crazy. But yet today, we can do that. And the problem, though, I think, is that actually healthcare has actually deteriorated for a bunch of reasons, despite the technology. And so, in our current system, it's a fee-for-service system, right? It's an illness-based model, and I think that's ultimately the the root of the problem, right? In other words, people have to get sick for you to go see a doctor, and the doctor's livelihood depends on a patient getting sick.